Mr. President.
Majority Whip.
Mr. President, this is an historic day in the annals of the United States Senate because we are faced with a critical vote as to whether we can pass the bipartisan compromise on spending or default on our debt for the first time in history, whether we will fail as a nation for the first time ever to pay our bills. There's a strange construction in the law where we can vote in the Senate and in the House for spending, send it to the President who signs it into law, go back to our states and districts and announce in press conferences that we have millions of dollars coming home, federal dollars back home to our states and districts, and take credit for it, and then not face the reality that the money that we've appropriated actually adds to our national debt. The debt ceiling is the mortgage of the United States, which needs to be expanded as we spend money. So we reached a point where we had a deadline, first June 1st, now June 5th, of doing something in Congress to extend the nation's mortgage or default on that mortgage and debts for the first time in history. There was a ferocious negotiation that went on for weeks. It was precipitated by the threat of one person on Capitol Hill, Speaker Kevin McCarthy, who said, "I'm willing to risk defaulting on America's debt." All the other leaders, including the Republican leader in the Senate and the Democratic leader, said that is unthinkable. We would pay a price for that for generations to come. The reputation of the United States, the value of the United States dollar would be in danger because of such a careless and reckless act. So a negotiation was underway for the last few weeks. An agreement was reached to Speaker McCarthy's satisfaction, and it passed the United States House of Representatives yesterday. Now it's our turn in the Senate. We've taken a look at this agreement. First, let me say the premise is this: defaulting on our national debt is unacceptable, unthinkable. We cannot let it occur. So as painful as some of the decisions that will come from this agreement reach, they are virtually at this point inevitable to avoid default on our debt. There's one I want to zero in on because it means so much to everyone in this nation. And most people don't realize that it's been part of the debate and negotiation in this compromise. And that is the question of America's commitment to medical research. The National Institutes of Health is the preeminent medical research institution in the world. When it comes to discovering cures for diseases, new medications, it's the National Institutes of Health and the Food and Drug Administration which are charged with that responsibility, and we lead the world in research. I'm such a fan of this agency that I could speak for a long time about what they're doing. But suffice it to say that if you or a member of your family have a diagnosis from a doctor that scares you to death, one of your first questions is, "Doctor, is there anything we can do? Is there a medicine? Is there a surgery? Is there anything we can do?" Some of us have asked that question, and we pray that the answer is yes, and we pray that it leads us back to the NIH and all the work that they put in. So here's what we face with the budget agreement that passed the House, now headed to the Senate. We asked the experts on the budget to tell us what's going to happen to the budget of the National Institutes of Health, the preeminent medical research agency in the world, as a result of Speaker McCarthy's demand that we cut spending. What will happen is this. We face this prospect almost with certainty. We're going to see a cut in the NIH spending for the first time in 10 years. For 10 years, we have consistently increased research funds, and they paid off. Finding that vaccine for COVID as quickly as we did was no accident. It was planned through medical research, and it saved so many thousands of lives here in the United States and beyond. So here we face, for the first time in 10 years, a cut in the budget of the National Institutes of Health. How much of a cut? At least $500 million. $500 million. And I stepped back and I thought to myself, you mean we're going to cut medical research? that was Speaker McCarthy's idea of fiscal conservatism, that to me is mindless. It may have some political goal in mind, and I don't know what it might be. But to cut that makes no sense.